Hello. Hello. Am I audible, everyone? Can see your messages. 1 second. Okay. All right. Good evening, everyone. Welcome back. All right. So, I'm really sorry for the earlier technical glitch that we had. Good evening, Rizwan. Good evening, Mahesh. Good evening, Karna. Good evening, Sharif. Good evening, Kumar. Everyone. Thank you so much for showing patience. All right, we had some technical issues. So today we have a very important session. It's on who am I, or rather we should say high yielding and important images for PSM. Okay, so before we begin, this is Dr. Neha Taneja. I am a public health specialist by profession, but I am a mentor, guide, and educator by passion. So these are the various groups where you can follow me on my Unacademy profile, on my Telegram group, channel, Instagram, everywhere. Just a little heads up, we've also started a Target Next 2022 batch on Unacademy. So basically, we this batch has also started one from January 8th, so you can become a part of this batch. These are your wonderful educators who will be teaching you live on the platform. It is based on concepts, revisions, strategies, MCQs, and images, and a lot more. As for me, in this batch, in the month of January, starting from 18th to 28th of Jan, everybody, I am going to take a 54 hours of PSM session, which will be 6 hours every day. So we'll be beginning at 7:30 a.m. in the morning with half an hour breaks, and we'll be finishing by 2:30 p.m. So by half of the day you will be done with so much of PSM. I'll help you make PSM learning interesting for all of you with the help of images, MCQs, recent updates, numericals, and a lot more. All right, so if anybody wants to subscribe for January for this particular course, you can use my code PSM10 and get a 10% off as well, or Dr. Neha 10. All right. Yes, these are your wonderful educators who will be teaching you live on Unacademy platform for FMG batch course. All right. As for my classes, we have free live classes currently going on. Tomorrow, you can attend a free live class at 4 p.m. on national health programs with healthcare delivery system. So, this will be absolutely free on Unacademy platform. You can also use my code PSM10 to enter this free class. This is the schedule or list for the free classes that are there. 15th also 4 p.m., 16th also 4 p.m. And also we have a few classes in the morning. Tomorrow at 9 a.m. you can attend an infectious disease epidemiology class. On 15th morning, you can attend a family planning and recent updates and programs related to it. And also on 16th morning, you can attend a COVID-19 class, which will be absolutely free. For Plus subscription advantage, is you can get an access to daily live classes, structured courses, quizzes, and unlimited access to all that's happening live on Unacademy. You can also use the subscribe to the iconic subscription on Unacademy, where you will get best of Unacademy and the best of Prep Ladder. We can also offer you at discounted price. For any, you can use my code PSM10 or Dr. Neha 10 to get a 10% off. Also, we have daily free test series on Unacademy NEET PG, which you will help you practice for Unacademy exam for upcoming examinations. So NEET PG T20 series is at 8 p.m. NEET PG 2022 test series is at 9 p.m. FMG Daily D20 series is at 8:30 p.m. and INI CT is at 9 p.m. So you can start with all these practice all these MCQs by attending these free sessions. Okay, these are our syllabus batches for syllabus completion that are currently going on. I've already briefed you. Target next 2022. These are the current batches. You can select from any. You just have to download Unacademy app and subscribe. That's it. All right. Use my code PSM10 or Dr. Neha 10 to get a 10% off on any of your subscription. So let's begin with this. I've already told you, download the app and start. These are your prices. For 1 month, it's 4,500. If you use the code, you'll get an additional 10% off. And this is how the systems run, plus Iconic as well as NEET PG subscription. Okay. All right. So let us now begin with our session for the day. All right. So the first one over here, the question out is, how many ice packs are used to line a vaccine carrier? Sure, Alia, good evening. Sure, Mahesh, I would try to do that. If you're happy with the sessions, I would definitely align more of sessions for all of you. So this is a vaccine carrier. So this is the first image that you see. It's a blue colored vaccine carrier. So let's see your answers. Mahesh is writing A. Some of you are writing 4. All right, so the correct answer to this is, how many ice packs are used to line a vaccine carrier, everybody? It's 4 ice packs. Okay, if you open this ice pack, if you open this vaccine carrier, you will see there are 4 ice packs which are lining this vaccine carrier. Okay, how many vials can a vaccine carrier hold, everybody? Can you tell me in the comment section how many vials can be contained inside a vaccine carrier? How many vials it is? 16 to 20 vials can be carried in a vaccine carrier. Okay, there is one more version which is actually a day carrier. Okay, if we talk about a day carrier, then day carrier is lined by how many ice packs, everybody? Day carrier is lined by 2 ice packs. Okay, it's just lined by 2 ice packs and it can carry a lesser number of vials. Okay, so this is the first question. A blue color box, or it can also be available, it can also come as a white color transparent box also. Okay, however, if you see a similar box which is red color, can you tell me for what it is? If you see a similar box which is red color, can you tell me, anybody, in the comment section, for what it is? What is a red color carrier for? Anyone? So let's see how many of you how many of you know that. A red color one. Very good, Alia. A red color carrier box is to carry stool samples, okay, from the cases of AFP. When we carry the stool samples, they are carried in a red color carrier box. So that is basically reverse cold chain. It's just that the stool samples to be preserved require the same temperature of +2 to +8 degree C. Alright, let's go to the next image, everybody. Yes, this symbol depicts which disease? So let's see your answers. Yes, Rizwan, exactly. White color or blue color is for polio. Red color is for reverse white color or blue color is to carry vaccine samples. Red color is for reverse cold chain. Okay, so let's see your answers. Good, this is a pink color ribbon. Okay, so a pink color ribbon is for what? It is for HIV AIDS. Pink color ribbon is for breast cancer. All right, good. So I can see some of you wrote B, some of you wrote C. Ashish wrote B, some of you wrote C. All right, this is pink color. Pink color is for breast cancer. But look at the various colors of the ribbon that you can see over here. All right, if it is a red color ribbon, okay, what does a red color ribbon denote, everybody? This denotes HIV AIDS. Okay, what is this blue color? There are 2 blue colors over here. Both the blue colors denote what? Prostate cancer. Blue is for boys, so it is prostate cancer awareness. All right, red is HIV AIDS. Green is mental health awareness. And when we see an orange and yellow one, this is for what? This is for suicide prevention. Okay, so yellow and orange is for suicide prevention. Got it? All right, is it okay? So these are the various colors of the ribbon that's available under our for image-based questions that can come in your examination. Now, GEAT strategy is targeted to improve, or in what is the current uh, exact answer for it? Mark the MCQ. To in why do we have the GEAT strategy? To increase cure rate of TB, increase detection rate of TB, increase notification of TB by private practitioners, or all of the above. Like, what is the main strategy that has been adopted under the GEAT initiative? So one, they could give you this image, okay, it's like a closed fist like this, so they can give you this image, and in your examination, of course, this will not be written. This is joint effort for elimination of tuberculosis, so this is for tuberculosis. But under the GEAT strategy, guys, what are we doing? We are trying to increase the notification rate of tuberculosis by private practitioners. That is our main purpose, okay? And when we say it's a joint effort, that means how many people or how many organizations are into it, along with your government, along with the National Tuberculosis Elimination Program. We have other NGOs like some like you have union, which is for tuberculosis, particularly path. All these things have, come together. The fight against TB, the one of the most important cause for us not being able to eliminate TB is non-notification by private practitioners. So to increase that, it is like the main strategy, okay? GEAT strategy ka the main strategy, if we ask you, the main strategy is definitely to increase the notification rate. All right, okay. Yes, increase the detection rate and cure rate are also okay, but the main strategy that has been adopted by the GEAT initiative is to increase notification rate of TB by private practitioners. Okay, let's see your next answers. Yes, Vinay, did you understand? Okay, now what is this? Used masks. So used masks are disposed in which color bag? Let's see your answers. Is it red, white, yellow, or blue? Used masks, everybody, are disposed in which color bag? Used masks are disposed in. Very good, Alia. Alia has got it correct. Some of you are writing. Shroff is writing. Vasasvi. Everyone. Very good. So used masks are disposed in yellow color bag. Okay. So now look over here. These are some of the tips that I had put out on my various channels. This is how you're going to dispose your personal protective equipments. Okay. Mask, both N95 triple layer, okay, will be disposed in yellow color. Head cover and cap, okay, they will be disposed in yellow color. Sorry, shoe cover in yellow color bag, disposable linen gowns in yellow color bag. All right, but when you talk about goggles and face shields, these goggles and face shields, everybody, are recyclable. Okay, so these, since all these things are recyclable, they will go into which color bag? Red color bag. Splash proof aprons, okay, not the disposable ones. The splash proof aprons, they go in red color. Gloves and hazmat suits, gloves, any type of gloves, nitrile gloves, latex gloves, sub red color bag mein jata hai, okay. And hazmat suit also goes into red color bag. So you could be given the image of any of these personal protective equipment and you can be asked where is it disposed. All right, let's see the next question. Yes, what is this? So this is the image of tracking of blood pressure. Okay. Now what does tracking of BP implies? Option A, BP increases with age. Option B, BP decreases with age. Option C, BP of hypotensive patients become hypertensive. Option D, BP of hypotensive patients remain hypertensive. All right, okay. gloves and everything will always go into red color bag. Manika, hazmat suit is an advanced version of a ppe where you also have a respirator equipment attached to it. Okay, in my subsequent sessions I will also try to show you an image of a hazmat suit, okay, so that you can remember it. Now I can see mixed answers here. Some of you are saying A, some of you are saying D, some of you are saying C. All right, now over here, guys, this is tracking of blood pressure. Okay, this was asked in NEET PG once. Okay, now this is the image for this is the image, everybody, for tracking of blood pressure. Okay, now over here what happens in tracking of blood pressure, guys? You are tracking the bp. That means bp, suppose you track the bp from when to when? You track the bp from childhood, all right, to adulthood. All right, you track the bp from childhood to adulthood. So if somebody's bp, say, remains low in childhood, you are tracking it, so it will continue to remain low in adulthood. Okay, if somebody's bp is high in childhood, it will continue to remain high in childhood. So what is the best definition over here? Bp of hypotensive patients remain hypotensive. However, if the bp of somebody was hypertensive in childhood, he or she will continue to remain hypertensive in childhood. Some of you wrote bp increases with age. That is not tracking. That is not tracking. Okay, that is a fact. All right, that bp increases with age. Okay, over here tracking means if somebody's bp is low at childhood, it will continue to remain low in adulthood also. If it's high in childhood, it will continue to remain high in adulthood also. Got it, everyone? Okay, so this was an important question. Let's see another one, guys. Okay, in the following figure, guys, which point is the usual time of diagnosis? Is it A, B, X or Y? So this is a very important figure. Can you tell me the usual time of diagnosis kya hai? In this we are trying to study the lead time. Okay, so let's see your answers. Very good everybody. Some of you are writing. All right. Okay. So I can see some of you are writing X, some of you are writing Y, some of you, yes. So the correct answer over here is D. Option D. Option D is this one, Y. Now, dekho, A is the time when the disease has started. It has started in your body. B is what? B is the first possible point of detection. Okay. B is the first possible point. Okay, B is the first possible point of detection, everyone. Okay, that means no matter what you do, guys, you will never be able to detect a disease between point A and between point B. So B is the first possible point of detection. What is X, everybody? X is the critical point of detection. Okay, beyond this, some changes start happening in your body. It can also become irreversible. So critical point of detection. And what is Y, everyone? Y is the usual time. Okay, usual time of diagnosis. Okay, Y is the usual time of diagnosis. So what is very good, and final outcome is Z. Now usually when the patient comes to us with signs and symptoms, we diagnose it, him or her. However, if by applying a screening test you are able to detect a person at the point B only, then this is the time we are going to gain, okay, in the detection of the disease. This is the time we are going to lead in the detection of a disease, which will be advantageous to the person in terms of survival. So what is lead time, everybody? The time which is applied, or the time that you gain between point B and between point Y. Okay, first possible point of detection and the usual time of diagnosis. The time that you gain in between is known as lead time. Got it, everyone? Give me a thumbs up if you've understood this concept. This diagram comes and they also ask you the second question, which is what is lead time? So lead time is the time with which you are leading in the detection of a disease. All right, it is the time by which you are leading in the detection of a disease. All right. Now, tell me guys, what is the answer to this? Identify component of NACP as shown in the photograph. Is it ART? Is it ICTC? Is it PPTCT? Or is it blood transfusion? So let me see your answers, everyone. Okay, let's see your answers. Okay, good. So I can see some of you writing C. Very good. So this figure is prevention of parent to child transmission. Please remember, it's not ICTC or it's not ART or blood transfusion. This is prevention of parent to child transmission. Now the risk of mother to child transmission, everybody, in developing countries is how much? Can anybody write in the comment section? The risk of parent to child transmission in developing countries is how much? And in developed countries is how much, guys? The risk of parent to child transmission in developing countries is 30%. Okay. And in developed countries, it is 25%. Okay. But if I ask you, parent to child transmission contributes what percentage of total cases of HIV? Okay, if I ask you, mother to child transmission or parent to child transmission constitutes what percentage of total cases of HIV? Can you tell me in the comment section? Or what is the burden that it is actually constituting? No, not 80%, not 20%. What is it? It is only 5%. Okay, this route of transmission is responsible for 5% of total HIV cases. Okay, but the efficiency of the route, okay, remember these terms. This is efficiency. Okay, so efficiency of the route, everybody, in developing countries is 30% and in developed countries is 25%. Got it? All right, remember this symbol for parent to child transmission. This is a very, very important symbol as well. Okay. All right, let's see some of the other questions. Yes, what is this? The image represents larvae of which mosquito? Is it Culex, Aedes, Anopheles, or Mensonia? So what is this image representing the larvae of which mosquito, guys? Culex, Aedes, Anopheles, or Mensonia? Very good. Over here, when you look at these larvae, what it does not have? It does not have a siphon tube. Okay, so no siphon tube. It's just resting parallel to the water surface. It does not have any siphon tube. So this is Anopheles. All right. How do Aedes and Culex rest with the water surface? They attach to the water surface the larva with the help of a siphon tube. Look, I'll show you the image. Okay. So this is of Culex and Aedes. They attach with the help of a siphon tube. Okay, so I thought I will give you an image like this. Look over here, everybody. So this will give you an exact understanding of the difference between a lot of things. See, when you talk about Anopheles mosquito, okay, Anopheles, this is the egg of Anopheles. The egg of Anopheles is what shaped like this, okay. So this is what? This is boat shaped, okay, boat shaped with lateral floats. This could also come in your exams, and they are laid singly. Very good, Alia. All right. But in Culex as well as in Aedes, Aedes is what? This is cigar shaped. Okay. They are also laid singly but cigar shaped. And Culex is laid in groups. Okay. In raft. Okay. So this is Culex ka eggs. All right. This is the larva. Anopheles rests parallel to this water surface, does not have a siphon tube, so it's resting parallel. This is the siphon tube for Culex as well as Aedes. Okay, it attaches to the water surface with the help of this siphon tube. This is the pupa. All right. So what you are asked, everybody, very good. You have to remember about the larva. You have to remember about the eggs, and you have to remember about the adults. So if I ask you, what about Anopheles mosquito adult? How does it sit? It rests at an angle of 45 degrees to the person, all right, to the surface at an angle of 45 degree. And how does QLEX and ADs rest, everybody? They rest with a slightly hunchback appearance, all right. Now I'm going to ask you a few questions, you're going to tell me. Very good. Spotted wings, everyone. Spotted wings. Spotted wings is a feature of, spotted wings, everyone, is a feature of what mosquito? It is a feature of Anopheles mosquito. White stripes on a black body, guys. White stripes on a black body. This is which mosquito? Black, white stripes on a black body. So white stripes on a black body is Aedes mosquito. Okay. After that, if it is none of these, then it is a Culex mosquito. And for Mansonia, we have very long legs like that, like this, with white shining bristles. I will try to include those images tomorrow in the image session that we're going to have at 6 p.m. Okay, I will try to include that in that session. Okay, everyone. So have you understood this? Remember, Anopheles, eggs are single. Aedes, eggs are laid singly. But how are you going to remember that Culex lays eggs in masses? What is the hint to remember it? Culex is a nuisance mosquito. Okay, it breathes in dirty water. So it creates a lot of ruckus, a lot of nuisance. That is why it's laying its eggs also in clusters to trouble us. Okay, you can remember it that ways. All right. Okay, can we proceed to the next question, everyone? Very good. Also, C for a C, Vignesh. Good, you remember it from the classes. That's very nice. Culex is clusters. All right, chalo, let's go to the next question. Yes, identify the bar diagram over here. Simple, multiple, component or histogram. A lot of questions come from this. Simple bar diagram hai. Simple bar diagram hai, multiple bar diagram. Yes, that's also a good way. Ashish, C for colony and A for alone. Okay, so some of you are marking B, some of you are marking C over here. Bache, this is a component bar diagram. See, in components, we've divided this particular things into components. Okay, simple bar diagram kaise hota hai? How is it? Like this, say, is males and this one is, say, females. Okay, what is multiple bar diagram? Suppose we are talking about year 1900 and say 80. All right, this is January, February, this is again March of the year say 1980. Just an example. Okay, similarly over here you can have January, February, March. All right, this is of the year say 1981. So this is a multiple bar diagram. Can you tell me the other name for a multiple bar diagram, everybody? Any other name that you know for a multiple bar diagram? Very good. Multiple bar diagram is also known as composite bar diagram. Okay? And bar diagrams, how do you differentiate it from histogram, guys? Histogram is used to represent quantitative, okay, quantitative continuous data. Okay, quantitative continuous data. So in histogram, what happens? There is no gaps. All right, there is never any gaps. Okay, because it's continuous. Like we have height of a person, weight of a person. So weight could be 20, 20.1, 20.2. So there's no gap. But a bar diagram, guys, is used to represent qualitative discrete variables. All right, discrete, like you can have genders, religion, socioeconomic status. So obviously somebody blood group, somebody will be A positive, B positive. They can never lie in between A and B positive. All right, so did you understand this diagram? This was an important question again. Let's see a few more images. What is this one, guys? Identify the instrument. Is it a Horrocks apparatus, chloroscope, chloronome, or none of the above? Can you tell me in the question section? All right. What is this? Is it a chloroscope? Is it a chloronome? Is it a Horrocks apparatus? Very good, spectacular vlog. Very good, Mahesh. Nahi, Mahesh, you've written A as the answer. So some are writing C, some are writing B, Some are writing A as well. Guys, this is a chloroscope. Okay, chloroscope क्या करता है? What is a chloroscope used to do? A chloroscope is used to measure the residual chlorine level. Okay, when we have to see that we've achieved the residual chlorine level, we use a chloroscope. Okay, so what is the residual chlorine that is allowed, that we have to keep in drinking water, everybody? 0.5 milligram per liter of drinking water for a contact period of how much? For a contact period of 1 hour. Okay, this is the amount of residual chlorine that we should leave. All right, yes, very good. Okay, now Horrocks apparatus कैसे होता है? You have 6 white cups and 1 black cup. Okay, I will try to show you the image tomorrow, okay, of a Horrocks apparatus also. And chloronome is mostly Patterson's chloronome, which is used for, you know, regulating the amount of chlorine. Okay, it is used for regulating the amount of chlorine. So I'll show you these images again in tomorrow's class as well. Okay, all right. Can you name any test which is used to see whether residual chlorine has been reached or not? Any test for residual chlorine that you know of? Any test that you know for measuring residual chlorine, for knowing residual chlorine? Tell me in the comment section, everybody. It is orthotoluidine test, and it is also orthotoluidine arsenite test, out of which orthotoluidine arsenite test is more important. Okay, all right. So now tell me, where is the headquarter of this international health agency located? New Delhi, Geneva, New York, or Rome? Where is the headquarter of this international health agency located? FAO, Food and Agricultural Organization. Very good. So the headquarter of FAO is located in, yes, absolutely correct. The headquarter is located in Rome. All right. Okay, so the headquarter is located in Rome. Now I'll ask you a question. Do you know something else where this FAO is of huge importance? Something else where in nutrition only where FAO is of huge importance? FAO. So yes, very good. It is Codex Alimentarius. What is Codex Alimentarius, everybody? Codex Alimentarius is the international food standards which has been set by WHO and FAO, and the Indian standards have been adopted, or food have been adopted from these Codex Alimentarius, and is given by FSSAI, Food Safety and Standards Authority in India. All right, got it? Okay, let's see some of the other images over here. You can just have a look over here. This is UNDP. What is this one? What is this one, everybody? What is this image, guys? Can you tell me this one? This is United Nations. Okay, UN, United Nations, and this one, everyone, is ILO. Okay, where is the headquarter of United Nations? It's just that how are you going to remember United Nations? And don't get confused from WHO. WHO has a sword in between. This does not have. Where is the headquarter of United Nations, everybody? Yes, very good. It's in no, not in Geneva. United Nation. Very good, Ashish. It's in New York. Very good, Vamshi, Vashasvi, everyone. So the headquarter of United Nation is in New York. All right. So this was an important question that you must remember from today's session, guys. All right. Okay. And let's do some of the other images as well. Okay, somebody can tell me where is the headquarter of ILO, guys? Where is the headquarter of ILO, guys? Anyone? Can you tell me where is the headquarter of ILO? Headquarter of ILO is in International Labour Organization. This is again in, very good, Vasasvi. This is also in Geneva. All right. Okay. What about UNDP? United Nation Development Program. United Nation Development Program is also in New York. Like I've taught you, most of the things which start with United, all right, it is in New York. All right, good. Okay, so this was a very important question. If I showed you an image of UN AIDS, UN AIDS, where is the headquarter? It starts with UN, but where is the headquarter, everyone, for UN AIDS? It's in Geneva. All right, you remember the image of Geneva? Tomorrow I will show you the image of Geneva also. It's just that it's the same globe, all right, and on top of it we have a red color ribbon. All right, will you remember this? So most of the things that start with UN, like United Nations, New York, UNDP, all right, UNDP is also New York. Okay, so all these things, UNICEF, one of the most important one, UNICEF. Where is the headquarter of UNICEF, everyone? Where is the headquarter of UNICEF? Again, it is New York. Okay, so it is starting with UN, United Nation with UN, UNDP with the UN. All these important ones have their headquarters in New York. Other than, except one important one, which is UN AIDS. So this has its headquarter in Geneva. Got it? All right. Okay. So these were some of the important questions. One more, since we are talking about it. How many of you have seen the image of World Bank? How many of you have seen the image of World Bank? Where does World Bank have its headquarters? W for a W. So this has its headquarter in Washington. Okay, W for a W. No, not Geneva. Yes, and WHO has in Geneva. All right, WHO has it in Geneva. Okay, will you remember this? UN AIDS and WHO and ILO. Okay, UN AIDS, one exception. WHO and ILO, all of them have their headquarters in Geneva. Okay, good to go. All right, let's have a look at one more question for the day. What is this type of disease distribution, guys? Is it endemic, epidemic, pandemic, or none of the above? Let me see your answers. What is the correct answer to this? Is it endemic, epidemic, pandemic, or none of the above? All right, is it endemic, epidemic, pandemic, or none of the above? So some are writing A, some are writing D. ठीक है, कोई बात नहीं. All right, good. So the correct answer, everybody, this is which type of disease distribution? Endemic. See, it is constantly present in a region. Okay, it is constantly present in a region. How do you know that it's not an epidemic? Tomorrow at 6 p.m. I will show you images of all the types of epidemics along with the distribution of the world. Okay, to so that you can differentiate between the different types of epidemic. I'll show you pictures and I will mark on the globe and ask you which type of epidemic is what. All right, tomorrow at 6 p.m. Now this over here, if we talk about an epidemic, it will be either a curve like this. Okay, so what type of epidemic it is? It is a point source. All right, point source single exposure epidemic. All right, then we'll be looking at other images tomorrow. Propagated epidemic, also continuous or multiple exposure epidemic, along with the images of the world. Okay, the map of the world, and in that you will identify and tell me what it is. Okay, so this was a very short class on images. I hope these 11 to 12 images have made you understand a lot of things, and you have also revised all the headquarters, okay, of a lot of international organizations. So I'm sure this class must have been helpful for all of you. Okay, do keep attending my free sessions on YouTube on Unacademy platform. Okay, also I will come live tomorrow again on YouTube at 6 p.m. guys, so you can attend that session. And just a little heads up, just a short reminder for all of you that tomorrow at 4 p.m. also we will be having a free live class on Unacademy app on national health programs with healthcare delivery system. Okay, so that would be a very nice class from 4 to 5:30 p.m. So you can definitely attend that free class. And I am teaching PSM on Unacademy during this January from 18 to 28. So you can subscribe to this patch course also. For if you want, you can take a 1 month subscription also. And aap is को सब्सक्राइब कर सकते हो, ठीक है, वेयर आई विल बी टीचिंग PSM फॉर 54 hours 6 hours every day starting from 7:30 a.m. in the morning to 2:30 p.m. All right, okay guys, thank you so much for watching, and be safe. Happy Lodi to everyone. Enjoy yourselves, don't stress out much. Thank you Ashish, thank you Arif, everyone, Vamshi, everyone. I will see you live again tomorrow at 6 p.m. on YouTube, and on my morning free sessions at 9 a.m. as well as 4 p.m. ठीक है, bye bye guys, happy Lodi, be safe, enjoy yourselves.